All right, so I'm going to talk about a couple hip exercises. So for starters, clamshells is a great hip exercise. It's meant for the gluteus medius muscle, which is right about where the back pocket is. And so it's pretty picky about how you want to have the patient do it correctly. So you want to have them here, legs about 90. You don't really want them here. You don't want them way down here. Hips about 45 degrees. And feet together. Make sure their pelvis is about in line with the ceiling. Don't let them fall out here. And you're looking for this motion. So I usually describe it as, with your feet together, lift up your top knee. And the biggest thing to focus on is you only want motion at the hip joint. This is the hip joint. Not here, that's your spine rotating. You want it just at the hip joint, because everyone will do this. And now you're working this muscle, but then you're working all this too, which we don't want. We just want the gluteus medius pulling that leg back. Ways to progress this exercise: you can put a band around the knees if it gets too easy without, but you'll find that even just this, if they do it correctly, like I can feel it. And then another thing you can another way to progress it, feet up like this and doing it this way. Now that's more advanced, but I definitely can feel it now. So if they have a hard time getting the band around their knees, sometimes this can be an appropriate progression. So that's for the gluteus medius, which is a hip abductor, abductor, and hip external rotator. They become really beneficial for people who have knee pain, as well as hip pain, and sometimes even back pain, because sometimes strengthening the hip helps stabilize it better, which then decreases the strain that goes to your knee, or can even help with the strain that goes to your back when your hips are stronger. So that's why that's a beneficial exercise.